Hi, my name is Beaubrun, and I'm a board-certified behavior analyst with Brett DiNovi Associates. In this video, we'll be talking about ADHD treatment, medication, and behavior analysis. The BCBA task list areas that we'll be covering is G1, use of positive and negative reinforcement procedures to strengthen behavior, G6, use of instruction and rules, and H9, collaboration with others who support and provide service to clients. Attention Deficit Hyperactivity Disorder, ADHD, is one of the most common neurodevelopmental disorders of children. The treatment of ADHD is medication as well as behavior therapy. This includes parent training. Although behavior therapy is a treatment for ADHD, it's a minor area of professional emphasis according to the 2020 Behavior Analytics Certification Board certificate data. Stimulant medications are commonly prescribed for attention deficit disorder. Behavioral pharmacology combines the methods and concepts, characteristics of experimental analysis of behavior and those characteristics of pharmacology, which is the study of drugs and their actions on living systems. Behavior analysts can collect and analyze data to determine the effectiveness of both stimulant medications as well as behavior modifications and parent training. Peer-reviewed research articles examine the effects of common classroom contingencies and stimulant medications to determine if changes to disruptive behavior were in fact altered by stimulant medication. Research articles also describe behavior analytic techniques that are effective for treating ADHD, such as acceptance and commitment therapy, differential reinforcement, token economy systems, and visual cues used to establish rules and set expectations. Practitioners can examine their own client data to analyze the effectiveness of interventions when treatment planning. A prescribing physician will make the determination whether or not to prescribe a stimulant medication to treat symptoms of ADHD. Behavior analysts can use data collection to monitor the medication's effectiveness. Factors that may contribute to the effectiveness of medication are hormonal changes as the client approaches puberty, the type of medication, the prescribed dosage, the time it is administered, and how it interacts with other medications. Behavior analysts can measure specific behaviors that ADHD medication is intended to treat. For example, if the intended effect of a medication is sustained focus, the target behavior would be looking at the duration of on-task behaviors. If the intended effect of medication is to reduce impulsivity, the target behavior for behavior analysts to collect data could be on calling out and elopement. If the intended effect of the medication is improved mood, the target behavior could be measured in terms of participation and social interactions. If the medication's intended effect is to increase attention to detail, the target behavior that can be measured, task completion and self-correction. And if the intended effect of the medication is improved memory, the target behavior could be on following multi-step directions. In the Kelly et al. Article, the researchers evaluated the effectiveness of stimulant medication on response allocation when antecedents and consequences were influenced. The participant was an 11-year-old boy diagnosed with attention deficit hyperactivity disorder with moderate intellectual disability. The participant's pediatrician prescribed amphetamine medication to decrease hyperactivity and inattention both at school and at home. During the pre-assessment, the participant received medication as prescribed. A preference assessment and functional analysis were conducted. Escape from demands and access to tangible items, like video games, was identified as the maintaining function of the participant's problem behavior. The treatment package included differential reinforcement of alternative behavior in the form of a simple response chain to access a 20-second break from work and access to a video game. During the medication evaluation, the medication status, 20 milligrams of adrenaline or a placebo, was randomly determined on the first day of treatment and altered each day. During the intervention, if compliance occurred, the therapist provided a participant with a communication card to exchange to terminate demands and provide access to a video game. If problem behavior occurred, demands were terminated and the participant was provided with access to a video game. As a result, With the medication, the participant earned 97% of reinforcers for appropriate behavior and only 3% for destructive behavior. With the placebo, the participant earned 57% of reinforcers for appropriate behavior and 43% for destructive behavior. A limitation to the study was that there was only one participant and behaviors were only measured at one dosage level. It's important as behavior analysts to track and monitor behavior changes and medication changes, as stimulant behaviors may increase the likelihood of appropriate behavior, therefore increase contact with reinforcement. These types of results may help parents and clients make informed decisions regarding medication. Social play is not often measured in the context of medication evaluations for children diagnosed with attention deficit hyperactivity disorder, despite the fact that stimulant medication has been shown effective for improving social interaction in children with ADHD. In the LaRue et al. Articles, the authors evaluated the reinforcing value of social play for preschool children with ADHD. A modified concurrent operance reinforcer assessment was used to evaluate stimulant medication on a potential establishing operation. There were 5 participants in this study, ages 4 to 6 years old. During the criterion establishment condition, the criterion level to earn token coupons in the reinforcement assessment. During the reinforcer assessment, participants earned 1 of 3 coupons for a preferred item or activity: alone play, play with a friend, or quiet time. Medication status during the experiment included 1 or 2 medication dose levels and a placebo dose during the experiment and was altered daily, multi-element single case design. As a result, the procedure was useful for evaluating medication effects in at least 2 of the participants. For one participant, he displayed a gradual increase in the selection of play with friend coupon while taking stimulant medication, and a gradual decrease in the selection of play with friends coupons, and a corresponding increase in selection of a lone play coupon at the placebo dose. For another participant, he selected fewer play with friends coupons during the higher dose condition as compared to the placebo and lower dose conditions. Also, he demonstrated a corresponding increase in a lone play coupon selection at a higher dose condition. The results illustrate that stimulants may influence the motivation to engage in particular activities, including social play. Stimulant medication may increase the value of social play for some children and some doses. Implications for future research include participants with autism spectrum disorder and with other psychotropic medications. When teaching social skills, consider the side effects that medications may have as well. When targeting social interaction goals, behavior analysts can use an overlay similar to graphing behaviors targeted for decrease to identify if or when medication changes occur, like increased dosage or withdrawal of medication. This may impact social interaction as a reinforcer and may alter the reinforcement contingency for teaching social skills. Thanks for watching. Please subscribe to our YouTube channel, and to disseminate the science, share this video.